Welcome back to the Physio Foundations podcast, where we talk about the knowledge and skills that provide the foundation of expert clinical practice. So today I'm talking to physiotherapist Ellen Ball as part of the new grad series on the podcast. In fact, this episode is slightly different. It's not necessarily just talking to a graduate in their recent, let's say 5 years after graduating. This episode is going to be about alternate pathways in physiotherapy. So as you're about to find out, Ellen's done a range of things, including clinical practice, public health projects that she's involved in at the moment, and education. And I get lots of questions about alternate pathways, how you can get involved in research, education, traveling as a physiotherapist. We've done episodes on this in the past, and I'm really interested to find out more about what Ellen's been doing. I'm also going to ask her a little bit about her study, what made her a good student, because yes, she was a very good student and did very well. So her tips for you for your physiotherapy studies, if you're a new grad, your tips for transitioning from studying to being a new grad. And we're just going to go for a bit of a conversation and see what happens. So Ellen, really good to see you again. Welcome to Physio Foundations.
Hi, Luke. Thank you so much for having me. I'm very grateful to be here.
It's really good. So we've worked together. You're a student of mine, well, of the course. You're a graduate of Monash University Physiotherapy. There you did very well. You've come back and you've been involved in teaching with us, research projects, public health project at the moment at Melbourne University. But let's go back in time. Tell us a bit about your background and interests and what initially led you to study physiotherapy.
Yeah, thanks, Luke. I think I've always been someone who's been very interested in the body and healthcare and working with people. So I think I always knew that my career, I guess, would go in that direction in some way, shape or form. Even very early on at school, my favourite subjects were always the things like science and health and PE. So I think physio just felt like a natural combination of all these interest areas. And then I guess straight out of uni, I started working full-time in a public hospital as a physio at a public hospital in Melbourne. And I think once I started working in this role, I started to wonder whether full-time clinical patient-facing work 24/7 was the right environment for me, and I guess where I wanted to spend the rest of my career. I was really sure that healthcare was right for me, but I wasn't sure what my other options were and, I guess where I wanted to explore. So I spoke to a lot of people, asked lots of questions, learnt the value of a very good mentor very early on. And I guess the first transition I made was to work part-time clinically as a physio and then part-time at Monash Uni in the physiotherapy department. And it was then that I started to do, I guess, different forms of work, like you mentioned early on in the physio department around research, teaching. I did some project work within the department and I just really loved that style of work. And it was still, like I said, in that healthcare field, so an area that I was really interested in. And then I decided to take the plunge, and now I work full-time in public health in a public health project role at Melbourne Uni, and I'm also completing my master's in public health, which I'm loving and is really interesting. So yeah, bit of an alternate pathway, but yeah, happy with where I am.
We'll explore public health and what that means and perhaps how you got into that direction in a minute. Mentoring, you mentioned. That's been a big theme of this podcast. It's kind of why we're doing this. It's an alternate form of mentoring in a podcast form. So mentoring is really important when you're about to change direction. You're going to seek lots of opinions from people. Have you found mentors? Just give you an unplanned question here. What was your process for finding a mentor and getting that guidance for those decisions?
I remember very early on, and it could have even been you that said it, someone early on in first year prac said to us the importance of the relationships you'll make throughout this physiotherapy degree, and they really reinforced that the people that we work with throughout the course will most likely be our colleagues, bosses, we might be their bosses, and physio is a small world, and to value those relationships that you build. And I think I took that quite seriously. And I, from the day one in the physio degree, I really tried to, make the most of being around such skilled people and such skilled people that were really willing to help. So a lot of my mentors came from the, lecturers and tutors at Monash. And then after uni, there was some that I knew I'd stay in touch with. And I guess that's kind of how it grew from there. I just made sure we stayed in touch and kept growing those relationships.
Jodie Daykick may be the person who said it's a small world, the world of physiotherapy, which she says a lot. And so that there may have been some mentoring advice there from Jodie as well, who's been on previous episodes. So I think that's a really good tip for everybody to think is a small world we're in, but how can you get mentoring relationships happening right now, even as a student? So that helped you. And so that probably helps answer my next question, which was people are probably wondering how you got involved in various research projects and education, how you got your foot in the door, and that led to the next stage of your career. So one of the answers to that is, making relationships and being known to people. How else did you get your foot in the door?
Yeah, it's funny you mentioned Jodie Daykick. She is such an important person in my career and such an important mentor to me. She was actually the one that I reached out to after I'd been a physio for a little while and I wasn't sure where I wanted to go next. So I reached out to her by email and we got a coffee and I just talked to her about where I was at and how I was feeling about everything. And that was actually how I got linked in with everyone working at Monash, and it grew from there. So I think, just having the initiative and having that, just asking the question, I think is really important. Most people are very, very willing to help and they want to help. So I think having a think about what questions you want to ask and just making sure you ask them is really important.
And not feeling embarrassed or self-concerned in any way from asking questions. You're supposed to ask questions.
Yeah,
absolutely.
I think also if they don't have the time or they're not able to, they will tell you. And if they are willing to, they will do it. So, I think just you have to put yourself out there and trust that, people are wanting to help. So that's, I guess, how I went about it.
They're really good bits of advice. So then now you're in this career in public health. Let's stay back in the physio course here and try to unpack how you got to where you are now. You're using skills throughout your training, your interpersonal skills, professional skills, knowledge. What skills did you develop as a student that you're using today? And how did that time in the physiotherapy course set you up for the work you're doing now?
Yeah, I think a really key one for me is just the critical thinking and problem-solving skills that you learn sometimes subconsciously, I think, that you don't actually realize you're developing them. But, we do CBL, we do problem lists on clinical placement, your clinical supervisors, they're trying to understand your why. And so I think physios are such good problem solvers and such good critical thinkers because we have to be to get to a management plan or a treatment plan for our patients. And again, going back to my fabulous mentor, Jodie, she actually said to me, I've never forgotten it and it's like stuck with me. But she said to me, she's like, Ellen, as a physio, you're taught to thoroughly assess a situation, implement evidence-based strategies to see if they can make a difference, and then reassess to see if they've worked. And she said, you will use that cycle of thinking no matter what you do. And she couldn't have been more right. Like, I think that cycle of thinking, whether you want to call it a quality improvement cycle or a cycle of inquiry or what you want to call it, you use in every job. And I definitely use that a lot now. And I think thanks to physio that I have been able to develop those analytical problem-solving, critical thinking skills, whatever you want to call them.
That's a good answer. I have deja vu. I think you've told me that before. I think we've had this conversation before about how you're applying that critical thinking in your current work. So that's one of our perennial questions. What do you think the most important knowledge and skills are for a physiotherapist? So one of them, according to Ellen, is that critical thinking and that framework of thinking and problem solving. Is there anything else that you think? Let's talk to clinicians who are working 100% clinical roles. What other skills are important and knowledge?
I think that relationships and communication are really at the foundation of what you do as a physio. I personally found that I worked both in public and private settings as a physio. And I think in both those settings, your communication and your ability to build relationships is really foundational. And I think when I say communication, I think that can look different. That's like encompasses many different things and can look very different depending on the situation it's in, whether that's speaking to a non-English speaking patient and having to use different forms of, verbal, non-verbal communication, or whether that's, building a relationship with someone to get them on board with your management plan that's experiencing, long-term pain or something. Or I think there's many different forms of communication, but I do feel like that's, I guess, foundational to what we do, and an ability to adapt your style to suit the environment you're in, I think is really, really important.
Yeah, that is important. Adapting your style to different health professionals, to different patients. So so really when everyone says communication, but you focus there on those interpersonal skills and sort of tying that into relationships and building a network with people and mentoring. It's got to be a people person, don't you? You got to be able to have a conversation and listen.
Yeah, exactly. Yeah, it all comes down to relationships. I think no matter where you go, I think, relationships are just at the centre.
So you're in the weeds, you're studying the fine details of biomechanics, anatomy, those types of early subjects that happen in the degrees. How do you develop your interpersonal skills as you're going as a student? Some of the tips we give students are, if you mentioned international students who are studying in a language other than their preferred language, practice conversational English, go out and meet people and perhaps work a retail job. What strategies helped you to develop those interpersonal skills and get good at talking to people?
Yeah, I think one thing that's much easier to say once you're out of it and a lot harder to see when you're in it. So I do acknowledge that. But I think now I'm out of the course and I'm looking back, I guess. I think that there's so much in the course that sets you up for these skills that in the moment might not feel like it's super important or, is a core foundational skill, but then you look back and you think, I get why we did that. So even things like our skills masteries, they always had, different case presentations, different patient presentations, and actually taking those experiences seriously and taking that as a learning opportunity. Or things like, when we go on placement, we have to send formal emails to our supervisors to start off that relationship, and we have to build relationships with our supervisors. All of that is building up skills that in the moment might seem like just, a natural thing. We have to do it. We have to tick the box. But I think all of those incidental activities and assessments that we do actually do really come together and build up a valuable skill set. Does that make sense?
Oh, yeah, it does. And it's been referred to as the invisible curriculum.
Yeah.
It's not so invisible. With it very deliberately built in opportunities to use your communication skills, and we make you initiate contact with your clinical educators, for example. So that's a really good response. Do you think are there more challenges these days for people, perhaps the 18 to 21-year-old age bracket, going into a really demanding full-time entry to practice course like physiotherapy, in terms of distractions and other forces competing for their interest? So I'm always thinking of how poorly I would have done it when I was in first year physio if I had a smartphone connected to TikTok. There's a lot of skills you need now in managing distractions as well. How do you think you would go 10 years on if you had a smartphone in your pocket with TikTok connected?
Yeah, I know. It's very, very true. And I think, like I said, it's so much easier for me to say now with hindsight, being in the position I am, not being back in first year with access to all the stuff that's out there now. But I think again, I probably think back to again what we were told in first year prac around, everything you do in your physio course will add up and will continue to, you know, grow your career. Similarly, building those relationships, all of those things. So I think if you can try, I mean, it's hard. I know it's hard, but when you're in physio, really think about, I know right now in this prac, it might not seem like the most important thing, but I promise you all of that stuff does add up and build up to one day be like, oh, now I get it. Now I understand why it was so important to be present in that moment and build that relationship and have that conversation. So I'm not sure if that fully answers the question, but
there's no full answer to any question. It's just our perspectives here, but they're really valuable. So
yeah.
I think let's segue into alternate pathways that people can take. They may not have thought about what you're doing at the moment. So you're in a project role in public health. What's public health?
Wow, big question. Public health is lots of things, and I think that's what's so awesome about it. And I'll be transparent that, again, I'm actually only quite fresh in this area myself, and I'm only just, you know, fresh in my Masters of Public Health, so I'm still learning about it. But I think public health can look different in lots of roles. I mean, I am really passionate about the project space, so projects relating to improve public health outcomes. But I guess in a nutshell, public health is the work that improves the health of the public. So that can look like epidemiology, that can look like biostatistics, that can look like project work, that can look like health policy, that can look like health promotion, that can look like health research. Like, there is so many, I guess, avenues within that.
And you're at the population level rather than at the individual client level.
Yeah, exactly. So whereas I guess as a physio working one-on-one with patients, you're there with the patient, that's your sole focus. I'm really enjoying taking a step back and thinking, what can I do at a systems level? What is being done at a systems level? That has a flow-on effect to the direct patient work, but I really love the position I'm in now to think big picture, think strategically, think systemsy. That's a word.
What's it like going back to study, having been working for 5 years and now you're back doing your Masters? Oh, I've done it myself, but I want to know how you're finding it.
It's tricky, and it's about planning the time appropriately. Yeah. To be honest, having worked at Monash Uni in a teaching capacity, I've marked assignments and all that. That's really helpful. Having had that lens, and now going back to study, like, I've got a different appreciation for marking rubrics and all that sort of stuff and assignment description. So I think I'm coming at it with a different brain and a different level of knowledge, which has really, really been helpful.
Yeah.
And to be fair, a lot of what I'm doing aligns with what I do at work. So I can see the links in what I'm learning to what I'm implementing in my job. So that is, I work full time and I do the study out of hours, and I can see the links in the content to what I do at work. So that does really help.
So you touched on study skills there, and I don't want to go into too many details about your work, because that's, you know, your project work, or what you're doing there is, it's not so much about the content, it's about an alternate pathway. So it's a really good definition of public health and what you're doing. So you're doing a Masters in public health, and you've got some refined study skills from being an educator and a successful student. Can we go into some tips for students studying? Because you're working full time, you're doing a Masters on top of that, and you're doing well. You're showing that it's possible. And yet we've just talked about distractions and competing forces for our interest.
So,
and you're doing a good job with this. So we need to ask you about how you do this. So study skills, what are some tips for studying efficiently? And when you've got a lot of stuff to get through and learn.
I'm going to say a really cheesy quote, but I think this is almost a quote that I live by a little bit. Failing to plan is planning to fail. Is that right? I think I've said that right.
No, we need a source, but sure. That's good.
So for me, it's all, I have to have my week planned out very early on in advance, or sometimes my month planned out, to know, for example, what my work week's going to look like in my full-time job, what my social life might look like around that, then when I might have an assignment due, or if I'm working sessionally with you at Monash as well, if something's coming up, then how can I fit that into my schedule? So for me, it's all about planning. Like, I could never be someone that just in the last hour sort of put something together. That's just not the way my brain works. I understand that for some people it does. So I'm definitely not saying that I'm right and that way is not right, because everyone's brains work differently. But for me, it's all in planning. It's all in having a clear plan. So I internally know where my time and energy is going, and I still make time for the things that matter to me outside of work and study.
That is important, because without that, you will burn out and you'll lose interest.
Yeah.
I've got, if you fail to plan, you're planning to fail. Benjamin Franklin.
I think that's what I was after. Yeah, that must have been what I was after.
But I'm also aware that 95% of people who quote quotes from the internet are making them up. Albert Einstein.
Yeah, okay.
So it's my I'm feeling lucky Google search, but that's a good one. Failing to plan does create lots of problems for students when they're studying and doing things at the last minute. It's interesting you point out that some people will work differently. I know my lovely wife, Susanna, is someone who gets a lot of energy from the last minute and can still produce high quality work. And then others
my partner's the exact same. My partner's the exact same, yeah.
And it was interesting that you weren't judging people who were doing it differently. You were just saying what worked for you is planning.
Yeah.
There's so many resources available now. There's so much information available that it can sometimes get overwhelming studying. You almost got too many good things competing for your interest.
Yeah, I agree with that actually. And a skill that I've learned, I think another skill actually that physios are really good at, especially having worked in a public hospital, is prioritisation. So you might have a list of 15 patients you have to prioritise. And I think that skill of prioritisation also is extremely transferable to study, to work, to anything you do, really, thinking about, what actually needs to be done right now and in this moment, and what can I, put on the back burner, whether it's, a week or a couple of days or what it is. So I think prioritisation is another skill that is essential for physios, but extremely transferable and useful in other environments.
We're building up this really healthy list of really good practical skills that you can get from postgraduate or undergraduate education, and they're good life skills as well. They're going to help you be a good student and a good educator and a good clinician. So critical thinking, problem solving, relationships, building relationships, and interpersonal skills, communication. And now we're on to planning and prioritization. That's one that I don't think has come up very often in these questions. Just the reality of having a very busy caseload, and you're the one who has to prioritize on the fly. And if you don't, you'll end up trying to do everything and pleasing nobody, whoever's quote that was. So that's a good one. So now how does your work in the hospital differ from your project work and your research work? It's completely different, isn't it? It's a different mindset when you go in and open up a computer and you have to plan out research-related work compared to being on the ward of a busy hospital. How are they different?
They're so different, but then I think there also is so many transferable skills. I think if I'm thinking purely about the differences, you have to have a little bit more I don't know if self-motivation is the word, but you have to drive your day. Like, it's not like you've got a patient waiting for you to drive your day. So you have to be more, strategic in how you schedule out your day and how you plan your priorities. Whereas as a physio on the ward, you have to see the patients before discharge, or you have to, do a double with the OT. That's just in the schedule. So I find that initially in that transition, a lot of it is a bit more self-motivated and it's a bit more self-directed, which I think can be a challenging transition. My brain actually works better in that self-directed way because I am a bit of a planner. So I do work quite well in that environment, but I think that is a transition and a shift initially for sure.
Some people are better suited to different areas, different working environments, be they rehab or hospital work. And there's hospital work and there's hospital work, isn't there? There's ICU, when there's emergency departments, and there's wards. So there's different environments. And then there's private practice, and that can be very slow and very quiet, or it can be extremely busy. And then there's running the business side of private practice. So it depends on your personality a lot, doesn't
Yeah,
it?
exactly. And I think for new grads, if you like that, or for physios that are that might listen, I think that can take time to figure out as well, to figure out what is the right space for you and what is the right way that your brain works. Like I think for me initially, like I think I'm figuring that out now, and I'm been out a while now. So I think that's one of those things that just you have to just, I guess, ride the wave, and takes time to figure that stuff out.
Riding the wave, that's a good way to put it. Just you do need to have the experience of what you're good at and what you're not as good at, and the environments that suit you best. So sometimes I'm asked, well, what should I do first, and should I choose this area of practice to go into as a graduate? And I think you probably answered that one. You need to ride the wave out and see where you end up. It's a good way to put it. Yeah. If you were a final year student, or perhaps think back to when you were a final year student, you're about to graduate, knowing what you know now, what advice would you give yourself?
I think it probably actually links into what we've just said, and that's probably a bit cliche, but I think being kind to yourself, especially at the times that feel unsettling or unsure. I think transitioning into full-time work is challenging as it is, let alone transitioning to, do I want to do private practice? Do I want to do hospital? Do I want to do inpatient? Do I want to do outpatient? Do I want to do research? I think that there is quite a few uncertainties, and it is unsettling. So I think definitely be kind to yourself as you go through that transition. And I think the more physios I speak to, the more common I think that, experience is. I think most people go through some sort of discovery phase, I guess, of figuring out what is the right area for them or what is the right path for them. So I think that would be a really key one in those initial phases. I think similarly to what we spoke about again at the start is utilize your mentors and utilize your relationships as much as you can. Because like I said, most people have gone through that same experience, and most people are willing to help guide and support you through that experience. So utilize those mentors and lean on the people around you, I think is really important. And I guess just from my experience over the last few years, I think as physios, we do have an extremely valued and transferable skill set, no matter where you go. So I think don't underestimate that. I think we do have a very valued and transferable skill set that can be used in so many different environments. So definitely use that to your advantage.
What a wonderful set of answers. I knew it would be good. There we go. We were talking beforehand, and we were shaping out what we'd talk about on the episode, and we left it open. And I reassured you that lots of good, useful bits of information for students and grads and anyone else listening would come out of the conversation. So yeah, being kind to yourself and seeking that support of mentors, and then valuing those skills that you have from your training are key themes that have come out of that. And I think they're really good messages. So we've taken a step back from content, and there was a couple of episodes ago was a 4-part series on qualitative research with Mel Farley. We're right into the weeds of specifics there for those who are interested and listen to those. And there's been episodes on content where we've really gone into details, but we're taking a step back there, and we're thinking about the longevity and happiness and productivity of you as a health professional or a student. And I think attrition from the health professions is a big unspoken topic. We don't talk about it too much. There's a lot of people who will leave the profession, and here you've found something that's related to physiotherapy that's you're very much using those transferable skills for. And I would say Ellen hasn't gone anywhere. You're not a stat. You haven't gone off and done a different career, and you haven't lost anything. There's no love lost for the physiotherapy profession. Is that the saying, Ellen? No love lost? You still love being a physiotherapist and what you're doing, and you're using those skills in a different field. In public health. And I think it's an interesting story for people who are planning out their careers.
Yeah, I completely agree with everything you just said, and especially around that it's not spoken about very often. And I think when I was going through the transition, that was the struggle that I had was, oh, this is a bit different. I'm not sure what this is going to be like. I'm not sure what this is going to look like. But I guess now I'm in it. I love the work I do now. I know that my skills that I used as a physio are valued by my current colleagues that are social workers. I work with a social worker. I work with a mental health nurse. I work with teachers. I work with someone else that's got a master's of public health. So I work in a very diverse team, and I know that those, skills are valued, and I can still use everything I learned in physio, but just in an environment that suits me better.
And I hope this gives, for those who are perhaps at a crossroads or they're thinking about what might be next, I hope this conversation gives you a bit of hope in terms of how you might use your existing skills and build upon them the next part of your career. I did misspeak before. No love lost. The Cambridge Dictionary. If there's little or no love lost between two people, they do not like each other.
Oh.
I don't use that saying often, no love lost, but no. You still love the physiotherapy profession and what it's done for you, but you were doing something different, and that's okay. Yeah. And if we're talking about attrition from the health professions, you don't have to give up and leave. There are lots of alternate pathways. Yeah,
exactly. And that's the thing that I've tried to stick with is, like, healthcare is still my area of interest, and improving health outcomes is still my area of interest. That is what I want to do, is improve health outcomes. I'm just doing it from a completely different lens and a different space now. But I guess fundamentally, my goal as a physio and my goal as a public health professional in a public health project are actually very similar.
Yeah, that's a really good final message. Well, I think we'll leave it there. But Ellen, you've really done a great job with your career so far, and it's really interesting to hear where you've gone and what's next for you.
Finishing this master's. Finishing the master's. Really embedding myself in my project. I think I feel like I'm a bit more settled now in what I'm doing. So I think just continuing on that journey and consolidating what I'm learning in the master's, and seeing what comes next, I guess. A bit more certainty. So if you're feeling uncertain about your career, that can come with time as well. You get into especially if you're a school leaver and you do a degree like physiotherapy, work for a few years, and you get into your mid to late 20s and life becomes a lot more certain. And to be honest, your happiness levels can really peak and increase through that time. So stay the path. What did you say before? Ride the wave. Ride the wave, yes. Yeah, I do hear that quite a lot, actually, just ride the wave. Yeah, get those mentors on your side and be kind to yourself. There's some really good messages for everyone. So let's leave it there. So thanks very much, Ellen, for the conversation, and we'll talk again soon. Great. Thank you so much, Luke. Thanks for having me. So everyone, if you enjoyed the episode, please share it with a friend, particularly someone who you think would value this advice or need some mentoring, or you'd like to do some mentoring with. I think these are important conversations to have. You don't have to work away on your own and keep all these thoughts about the bigger picture of what you're doing to yourself. It's really good to talk about these things. So please share. And if you found the episode helpful, let Ellen and I know. You can track us down through our details online or in the show notes. So until next time, this is Ellen and Luke wishing you all the very best with your studying, professional development, and lifelong learning.